All right, welcome back, everybody. Can't wait to get into today's show. We're going to be talking about advanced at-home lab testing. Some people call them functional medicine labs. I'm starting to call them more integrative health-based labs because it's not just about hormones. It's actually niching down in your area of expertise. And that's really what these at-home labs are all about. So keep in mind that only about, call it 10% of all health coaches worldwide are able to use labs such as, call them the food sensitivity test, or maybe looking at a minerals and metals test, something like that. And those labs are the foundation of every healing-based protocol. And that is why we teach them in level 2. And I recommend everybody learn them, even if you're not going to be a full-time health coach or even just using them for your whole family, because you get your food sensitivity testing, you get your vitamin and mineral testing, you get your hair, meaning your heavy metals in there as well. You learn about hormones, including cortisol and testosterone, DHEA and progesterone and estrogen, all your thyroid panel, your blood sugar numbers. You get your omega-6 to omega-3 inflammation, so important for the heart and the arteries and longevity. And then we're also looking overall at the gut, and that can't be overstated enough. That Candida Metabolic and Vitamins test looks at everything from yeast overgrowth, bacterial overgrowth, to mitochondrial energy, to neurotransmitter mood metabolites, to methylation, and so much more. So those are amazing. Those are the big 5 labs. And in level 2, we also teach the stool testing to look for really underlying root causes of the most chronic-based diseases. So might have H. pylori, might have parasites, might have bacterial dysbiosis, and we look at all that. So it's like those are the basis. But remember now, like that, you go from doing what 90% of other health coaches can't do. You read labs. Well, again, like that puts you in a class all your own. Now you're part of the 10%. Like 1 out of 10 coaches, that's it, are going to know how to use these labs. And again, it's not just about the labs, it's understanding the whole de-stress protocol. But if you can run the labs, it allows you to better personalize a person's program. So if you're a personal trainer, you're a chiropractor, you're a massage therapist, you're an esthetician, and you run one of these labs, like an esthetician running the food sensitivity test, a massage therapist running maybe the inflammation test, like you're able to then get that much more data for your client and you begin to understand these root causes. Well, there's another level to this that I don't know that all health coaches or practitioners in general realize this is at your disposal and able for you to be used in your practice. And it really comes down to, do you know who you want to serve? Because if you do, then there is another level to this that puts you in the top 1% of all health coaches and practitioners worldwide. Remember, very few people know how to run these labs. Now, they're not more difficult to run. It's just people haven't learned about them before. And I want to just share those with you. The mold and mycotoxins test. So just kind of keep in mind and remember that mold is really what we call the new Lyme disease. And why do we call it that? Is because so many people were affected with Lyme, call it 20 years or so ago. And that really started to crop up and people would realize that they may have had or have Lyme disease. Well, and I would say again, and I have my thoughts on that, but what I will say is this, is that mold and mycotoxins and the inflammation, headaches, postnasal drip, gut-based issues, kidney infections, etc., that's affecting probably 51% of our population, because we know that 51% of all homes in the US and also, especially like on the coast and over in Europe, are affected with mold. And so when you live in a damper or humid-based environment, we have to understand is this is something that can be affecting our overall health, a great niche for people to use. Okay. The next one is that neurotransmitters test, the mind and mood neurotransmitters test. Let's say you're working with children and you specialize in ASD or ADHD or ADD or executive functioning disorder or any childhood-based imbalance, or adults with lower mood, sleep issues, low drive. The neurotransmitter test looks at the dopamine, the norepinephrine for drive, the GABA and the serotonin for sleep and relaxation, and plus many more. So pretty phenomenal to be able to add to your niche, right? If you're working with kids with these particular issues, bedwetting, acting out, tics, etc., you'll want to run that neurotransmitter test, that's for sure. The next one is the environmental toxicity panel. An amazing one to look at, like hard to figure out cases where they've got these mystery skin rashes, mystery headaches, mystery brain fog, mystery joint pain. What if they're being exposed to environmental-based toxins? Simple, these last three that I named, just urine-based tests. Simple urine tests. You can learn them. You can understand the protocols also that go along with them. The menopause and fertility test. I'm telling you right now, this is going to be one of the most popular tests going forward for women. Call it age 35 to 55 years old. You run this test and you actually see where you are in perimenopause or menopause itself. You're actually looking at, it's like the stress mood and metabolism test from level 2, but instead of thyroid, we replace that with luteinizing hormone, FSH, follicle stimulating hormone, and then also AMH, anti-Mullerian hormone. So pretty amazing. And instead of guessing where people, practitioners are like, oh, you're just in perimenopause. Are you? Like, you might not be. Your symptoms might just be low thyroid, low cortisol in the morning, high cortisol at night. You're not in perimenopause. This lab test will actually share with you that. And it works great for PCOS as well. Okay, the sleep and stress test, amazing test, looks at cortisol and also melatonin production. How great it would it be to see if you're low on melatonin production, which is why you're not sleeping through the night. Well, we can test for that. And then the last one I wanted to share with you is the complete heavy metal toxicity test. Love this test, but I also use it for thyroid as well because it measures minerals like selenium and copper and zinc and iodine, essential for the thyroid. So I want to know that for my thyroid-based clients. And if that's part of your niche, great one for you as well. Plus it measures heavy metals such as mercury, etc. So amazing lab test. It's one that you can just do anytime you want instead of waiting for the hair to grow out on a hair tissue mineral analysis. So this is why I say if you are taking your health coaching career seriously or you want to take your education to the next level, this enables you to do that. Now, in terms of becoming a better coach, what does it really mean? Well, I just want to share with you, if I am working with a, let's say, child in my practice and they do have ASD diagnosis or they do have ADHD, I'm going to run something like the starter kit, which we call the vitamin tox test, and I'm going to run that neurotransmitter test. Like, without a doubt, those are my top 3. And then I'll say, okay, are you able to run also the food test or the omega-3 test? And if they're not, that's okay. But like, I'm going to niche, like that's my niche. That's my package for working with those children. When I work with a woman and let's say she's 37 years old, cycles are a little bit irregular, doesn't fully know what might be going on. I'm like, oh, well, do you want to actually see where you are in the perimenopause-based cycle? Great. I'm using that menopause and fertility test. Or helping a woman that maybe she's gone 12 months with trying to conceive, not able to conceive. Okay, we're going to run that menopause and fertility test. And these are just a couple examples. So as you can see, you can now pinpoint like mold, right? If your niche is mold, you can pinpoint this for your niche and you can develop a package around these labs. So that is absolutely what I do. I customize it for each individual, but also keep in mind that here's what we usually do. We try to do the big 5 with every individual, and then we'll work a program for about 12 to 16 weeks. It might last a little bit longer, but keep in mind, if there's still things to work on 16 weeks later, let's just call it 4 or 5 months later, we have these additional labs to go deeper on the data. Okay, we've done so much. Bloating's feeling better. This is feeling better, but there's still some postnasal drip. There's still some puffiness, in the face and eyes. Let's actually look at the mold and mycotoxins test. So it enables you to keep your clients knowing that there's always the next step for them. It is my belief that the issue with a lot of health coaches right now is that they don't know the roadmap that they need to bring their client on. And so for me, it's month 1, initial consultation and ordering the labs, getting them the labs. Okay, between now and then, we're doing the 21-day detox after they complete their labs. And then in month 2, we're going over their lab results and they get their first wellness plan. Then we're doing a follow-up in month, which would be 3, and that's their first follow-up. Now, let's say they were on the CBO protocol, we're going to ease back in certain foods. Easy. So now I teach them exactly how to do that. And then every month there's a new part to the program, right? That's what I call adaptive coaching. And you'll hear about that in my new book coming out in December. So, and again, it's really built for the health practitioner community. I wrote it for our community. I want everybody to read it, but it's for our community. And so why this is so important is that people don't need an every once in a while plan. They need a plan that adapts with them each month. And that is why my recommendation is that you simply have clients on a monthly program, $299 a month, $499 a month, whatever it might be. And the minimum is 3 months, and then they can cancel any time. And if you were at RHS HP live event this year, you know that that's really what we're moving towards. And you'll see that in our own practice come February, March of this year. It's like, listen, first 3 months, we need you to be a part of it because we need to do the initial consult, your lab results, and then the follow-up. Okay. After that, you cancel if you need to. Not a problem. But what we want to do is say, well, here's what happens in month 4. Here's what happens in month 5. And that allows you then to make those changes and also retest, run additional labs. That is the health coach of the future. By being able to run these advanced labs, you set yourself apart. Remember, when you set yourself apart, you can also charge a fair fee for your services because you're in the top 1%. It's different working with you than a general health coach. And again, nothing wrong with a general health coach, but once someone's moved beyond that, they say, I want access to all of these labs. I want to know there's always more for me. I want to know that I can ascend, and after I get well and heal, I can work on high performance health. I can work on optimizing my body. So I wanted to share that with you here today. If you want a deeper dive on what all these advanced labs are, you can just simply check them out at ihp.coach/level 3. And it's just the numeral 3. So ihp.coach/level 3. Check it out. Feel free to speak with one of our admissions people if you'd like. But in general, like I said, I believe this is that next step. This is this next level. If it seems like the right fit for you, amazing. It doesn't even have to be IHP. It's an overall philosophy of what the client of the future is looking for because there's more education on their part. They know that these things exist. They want them for themselves and their family as well. So hope you're doing well. I'll talk with you soon. I look forward to you having your best year yet.